introduce Alison Gilbert with Vanguard Investments. And so Alison supports advisors as well as Vanguard by providing really valuable content. She helps to write a lot of the newsletters and education materials that as advisors we are so dependent on to help us keep up to date on what's happening with the markets as well as for financial planning. And so Alison joined Vanguard in 2008 and served as a senior financial advisor with Vanguard's wealth management. So which really enriches her experience because she works with the end user clients are investors as well as advisors. So she understands deeply what is important in all the different roles. Her experience also was with E-Trade and Fidelity, and her bachelor's degree is in business administration with an emphasis on finance, and she graduated from the University of Colorado. And so I'm really thrilled to invite Alison to the virtual podium.
Well, thank you so much, Kim, and thank you all for taking the time to be with us tonight. It couldn't be a better time to discuss healthcare. We call this healthcare season, and that's for a reason. Medicare's open enrollment runs every year from October 15th to December 7th. So this is a really good time for us to check in and make sure that not only do we fully understand the system, the different opportunities there are, the different pitfalls we want to make sure that we avoid, but also really want to make sure we understand what's going to best serve you and your needs. So if we can go ahead and share the presentation. Perfect. All right, and let's just jump down one slide for me. All right, so during our time together today, I'm going to spend about 25-30 minutes going through this information. And then I want to make sure we save some time for some questions as well. I know this is a complex topic, so happy to answer any questions that might come up based on the information that we discuss. And what I'd also say is if there's questions that come up after our time together today, you can always reach out to Kim and she can get those questions over to me as well. So we're here to be a resource, not only today during this call, but also in the future as well. So in terms of what we're going to cover, we'll start off by just covering the landscape of healthcare costs and retirement right now. What's included, what's not included, how do we think about the system? We'll spend some time going through what we call the ABCs of Medicare. Medicare is a complicated system, so I want to make sure you leave this call knowing and understanding the different pieces, how they work together, and the different choices and options you'll have. We'll touch on how income affects Medicare, and if we have some time, we'll also touch a little bit on long-term care as well. I know that's a packed agenda, so I'm going to go ahead and jump us in. Let's go ahead and go down one more slide. And let's start off by just talking about the landscape of healthcare costs we might encounter. Now you'll see that the screen is separated into two buckets, and that's done intentionally. On one side, we have our traditional healthcare costs. Think your doctor visits, hospitalization, prescriptions, dental, vision, eye care. All of those things might fall under the traditional healthcare costs. Now, some of these will be covered by the Medicare system and some won't. So as you start thinking about your needs for healthcare during retirement, start thinking through, what are the different pieces that I want to make sure I have covered? Do I need vision care? Do I need hearing aids? Do I anticipate what's my family history look like? Now we have separated out long-term care, and that's intentional. Medicare, outside of 100 days in a skilled nursing facility, does not cover long-term care. Long-term care is an expense that we plan for separately. Traditionally, we think of long-term care as something we may or may not need during our lifetime. About 51% of people won't need any long-term care, but for those who do, it can be significant and can have a tremendous impact on the long-term success of their financial plan. Now, with long-term care, we think much more of stress testing the portfolios that we have in place. You may have a long-term care insurance policy, but if you don't, this is a great opportunity to work with your financial advisor and really stress test, not only will I be successful if I have a long-term care event, Will I be able to continue to cover my needs during my retired years? But how does this maybe impact the legacy that I want to leave? That can lead to some really good planning opportunities. But again, holistically, we're going to focus the bulk of our conversation on those traditional healthcare costs today. And like I mentioned, some will be covered under Medicare and some won't, but they're not going to be free. One big misconception with the Medicare system is that it's a free benefit. There is a portion of Medicare that's free, but the vast majority will come at a cost. And so we want to make sure we're aware of that. And we always remember, Medicare will care for the elderly, Medicaid will aid the poor. And most people's goal is not going to be to end up on the Medicaid system. So again, that's why we're going to be focusing on Medicare tonight. We can go ahead and jump down one more slide. Now, when we think about Medicare, initial eligibility is going to be at age 65. And that's why we see so many people anchor their retirement to that age 65 number, because pre-Medicare healthcare costs can be incredibly expensive. The way this will work is you will get an initial enrollment period. It runs 3 months before, the month of your 65th birthday, and 3 months after. This is the initial time. If you're going to be retiring at 65 or separating from your employer coverage, we need to make sure you get enrolled during that initial enrollment period to avoid any kind of late enrollment penalties. Late enrollment penalties are a big deal. Late enrollment penalties get tacked onto your Part B and your Part D premiums, and they're permanent. The way that they work is for every year that you could have had coverage but didn't, you'll pick up a 10% penalty on Part B and a 12% penalty on Part D, which is why it's really important for us to kind of hone in on when are you going to retire? And if it's going to be 65, are you well prepared to transition onto the Medicare system? Well, the next question I get is, well, what if I'm going to work past 65? Do I have to go onto Medicare? And the answer is maybe. As long as you have what we call creditable coverage from your employer, you can stay on your employer health plan up until the point that you're ready to make the switch onto Medicare. Creditable coverage is usually seen at larger employers. So think more than 20 employees and usually not self-employed, you likely have creditable coverage. If you're unsure though, if you're not sure if you have creditable coverage, contact your benefits administrator. Because what we don't want to have happen is that we assume you have creditable coverage, you stay on that coverage, you don't switch onto the Medicare system, suddenly you're ready to switch onto the Medicare system and we've racked up some late enrollment penalties. You should receive a letter the year in which you turn 65 from your employer confirming that you do in fact have creditable coverage, but if you don't, again, good chance to check with your benefits administrator. And keep that proof, because when you go to file for Medicare, once you're ready, let's say you're 65, you're going to keep working until you're 70, you have creditable coverage, so you don't have to sign up for Medicare. You delay that enrollment, and then when you're ready, you go to sign up, you're going to want to be able to provide that proof of coverage for those years. When you are ready, under that same scenario, you'll get what's called a special enrollment period. Now, this is an 8-month window from the point that you separate from your employer coverage for you to again switch on to that Medicare system. And as long as you get in within that 8-month window, you're good to go. You won't have those late enrollment penalties. Couple quick items on Medicare enrollment. If you've drawn Social Security early, so let's say you take your Social Security benefits at 62, 63, or 64, when you hit 65, you'll automatically be enrolled in Medicare. So you won't do anything, but it'll automatically enroll you. So if you don't want Medicare coverage, if you're going to stay on your employer plan, we want to make sure that you actually send your Medicare cards back and disenroll at that point in time. Otherwise, when you're ready to go on to Medicare, whether that's at 65 or at a later date for a later retirement, we generally recommend signing up for Medicare about 3 months before you want coverage to begin to make sure that you don't have any gaps in coverage. We're dealing with a government entity. It could take them 2 weeks to process the application. It could take that full 3 months. What I want to make sure is that you don't end up with any kind of gaps. Let's go ahead and jump down to the next slide. On the other side of the coin, you may be retiring early, so before 65, and you may need to bridge a gap between your retirement and Medicare age. Well, what options do you have in that scenario? Couple different quick ones. You may have retiree health benefits. Now, this would be offered by your employer. We're seeing less and less of these now. If you have these, you're likely well aware of them. It's likely part of your benefits package, and it may even be driving an early retirement. Again, that one's more specific. You have them or you don't. If you're going to retire early and your spouse is going to continue to work, you could just become a dependent beneficiary on their health plan. Benefits here. Your spouse is likely still receiving some type of employer subsidy, so it may be more affordable, and your spouse is likely used to that health plan. They're familiar with the specialists or providers you're able to see on that health plan. You can use COBRA. Now, COBRA is a short-term solution. It typically gives you 18 months of coverage, and it can be a little expensive. So when we think about COBRA, the way that it works, you maintain your exact same employer coverage that you had when you're working, but you start to pick up more of the bill. So let's say you were paying 25% of the cost and your employer was subsidizing the other 75. Well, in COBRA, you'll pick up your 25, you'll pick up your employer's 75, and you'll pick up to a 2% administration fee. So COBRA can be an expensive option, and it also has that short-term limitation, only 18 months of coverage. But the benefit of COBRA, you get to maintain your exact same coverage. You don't have to worry about finding new doctors or specialists. So we see COBRA used a lot, especially if you have a short-term gap to fill. The next option is the Affordable Care Act open marketplace. Now, we would say this is one of the more accessible options because it's not linked to any specific employer. You can find these plans on healthcare.gov, and you'll see platinum, gold, silver, bronze plans, and the level of coverage or the level or amount that the insurance company is paying for compared to what you're paying for will correlate directly with those different plan levels and their according prices. Worthwhile shopping this. If you're going to be retiring early, take a look at the Affordable Care Act open marketplace. Again, you find that on healthcare.gov. Look at those plans, see what they cost, and you can compare them. How does this compare to going onto my spouse's health plan? How does this compare to COBRA? And the last option is direct private insurance. Now, this would be going directly to like a United Healthcare, an Aetna, a Humana, and purchasing a policy directly through them. Now, this is usually a lesser used option. It's usually more expensive. So when we think about this, we usually see folks lean more towards those middle three options: a spouse's plan, COBRA, or the Affordable Care Act open marketplace. Let's jump down a slide. And that brings us to Medicare. So the Medicare system, we call it alphabet soup. There are a lot of moving pieces to this system. And like I said, I don't expect you to have these all memorized by the end of our time together today, but I'm hoping to make this a little bit more digestible. So as you look at going through this process in the future, you're more familiar with what are those different components of the Medicare system and how do I make sure I navigate those effectively. Let's jump down a slide. So we're going to start from the beginning. When we think about Medicare, Part A is your hospital coverage. Now, this is the free portion of Medicare. I say free with a big asterisk next to it because, yes, you paid into it your entire working career, but they'll give it to you for free once you're retired. Part A is the free portion. Part B is your medical coverage. So think your doctor visits, any testing, outpatient surgery, even an ambulance ride to the hospital gets covered under Part B. Part B is not free. At a minimum in 2024, Part B is $174.70, or about $2,100 per year. So if you just pick up what we call original Medicare, which is Parts A and B, you're looking at least $2,100 per year before any late enrollment penalties or any premium surcharges, and we'll talk about those as well. Part D is your prescription drug coverage. Easy to remember, D for drugs. This is added on to original Medicare, so Parts A and B, and the cost is really variable on Part D. I've seen Part D plans as low as $5 a month. I've seen them significantly higher, things $75, $100 a month. In terms of an average, we use $420 per year for an average for Part D. That's about $35 per month. It's variable because there's a wide range of coverage that you could pick up. It depends on what medications you take. If you take a generic or a name brand, where you fill those prescriptions, how you fill those prescriptions. Part D is going to have a lot of options that you could select. So whenever you think about Part D, your level of coverage will be, directly correlated to what coverage you select. So again, Part D gets added on to Parts A and B. Now, Parts A and B, or original Medicare, will cover 80% of your healthcare costs in retirement. So for some folks, they say, great, I enrolled in Parts A and B, I picked up Part D, Don't have to worry about any kind of late enrollment penalties, have 80% of my healthcare costs covered, whatever prescription drug coverage I selected, and I'll pay that 20% out of pocket. And that's fine until something catastrophic happens, because Medicare has no max out-of-pocket limit. So let's take an example. Let's say we have someone who retires at 65. They enroll in A, B, and D of Medicare on time, so they've done everything right. And for the first 5 years, they're healthy. They pay that 20% gap out of pocket, no problem at all. It really isn't a big burden on them. Let's say when they turn 70, unfortunately, they get diagnosed with a rare form of cancer. And let's say that cancer needs a really aggressive treatment plan. Let's say that treatment plan is going to cost upwards of $250,000 in one single year. Remember, original Medicare will cover 80% of those costs. That leaves them with a 20% gap, or about $50,000 out of pocket. So like any insurance decisions, when we think about this next part, we're thinking about insuring for the tail end risks. Let's jump down a slide. That brings us to our next option, which is adding on a Medigap policy. A Medigap policy is offered by insurers you know, United Healthcare, Aetna, Humana Gold, and it's going to ensure that 20% gap in coverage between original Medicare and all of your other healthcare expenses. Things to know about Medigap. It's flexible. So any provider that accepts Medicare, which is a very, very wide range, will accept Medigap. So if you're someone who splits their time between two states, maybe you spend the summers in Ohio and the winters in Florida, this is a great option because you can see providers in both places. Because it's more flexible, it's going to be more expensive. You're going to pay for that flexibility. Now, one really important part of Medigap, and if I had to pick one thing that was kind of the critical planning point, this would arguably be it for me. When you enroll in Part B of Medicare, you unlock a 6-month window to get into a Medigap plan with no medical underwriting. And this is huge. If you have pre-existing health conditions, if you know you want flexibility to see any specialist or provider, if you have family health history that might cause medical conditions in the future, you want to make sure you get into that Medigap plan within that 6-month window. If you miss it, you may still be able to get Medigap coverage, but you will go through full medical underwriting, and they can deny you coverage as well. Sometimes, even if they don't deny you, they may make it prohibitively expensive. So let's take our options. Let's go ahead and jump down one more slide. Now, Medigap is also alphabet soup, and they make it really easy to navigate because they make Medicare Part A, and then they have Medigap Plan A. Those are two different things. Remember, Medigap gets added on to original Medicare. Now, I don't expect you to know all these different ins and outs of these different Medigap plans. What you need to know is each of these plans covers a different portion of that 20% gap. Medigap A is the least comprehensive, so it covers the smallest amount of that 20% gap. It'll also be the least expensive. Right now, Medigap G is the most comprehensive plan on the market, so it's going to cover the largest amount of that 20% gap. So someone who has original Medicare, a Part D prescription drug plan, and Medigap G is paying very little, if any, out of pocket. Medigap N is our next most comprehensive plan to G. And I also always like to mention Medigap F is closed to new enrollees. So formerly, Medigap F was the most comprehensive plan. You may hear from a friend, a neighbor, a relative. They have Medigap F. It's closed to new enrollees post-2020. So just keep that in mind. So again, you'd select the plan that you feel most comfortable with, whatever is that balance of coverage and cost of that 20% gap. And then you would end up with the kind of combination. You have original Medicare, Part D, and a Medigap plan. Let's jump down a slide. That brings us to our third option, which is Medicare Advantage or Part C. Now, Medicare Advantage is going to work a little bit differently. It's going to wrap Part A, B, oftentimes Part D, usually other benefits like dental, vision. It may include things like a gym membership or travel perks. I saw recently a Medicare Advantage plan was sending out toaster oven, curling iron, you name it, I've probably seen it in terms of a Medicare Advantage incentive. It doesn't mean that it's bad, but it is very heavily advertised. And we want to make sure we understand what Medicare Advantage is and what it is not. So when you think Medicare Advantage, we're going to think more inclusive. There's more benefits that are getting piled into this kind of lumped policy. It's also going to be much less expensive than a Medigap option. But the drawback is it's less flexible. So with Medicare Advantage, you need to be willing to work in network to whatever that Medicare Advantage plan sets forth. And if you need to go outside of that network, you're going to need to pay out of pocket. So again, to summarize, here are our options. Option 1, you go original Medicare, so parts A and B, and Part D. Under option 1, you'll have 80% of your healthcare costs covered and whatever portion of your prescription drug coverage you select under Part D. Option 2 is we go original Medicare, Part D, and a Medigap plan. Remember, that option's flexible. We can see any specialist provider who accepts Medicare. We don't have to work in network. It's going to be more expensive. We'll have somewhere between 80 to 100% of our healthcare costs covered, depending on the Medigap plan we select, and whatever portion of our prescription drug coverage we select under Part D. Or our last option, option 3, is to go Medicare Advantage. Remember, more inclusive, more benefits kind of piled into one, lower cost, but more restrictive in who you see. Let's jump down a slide. When we think about these different options, there's not a right or a wrong answer. Medicare, healthcare overall is an incredibly personal decision, and it's one you want to make carefully. Remember, there's those decisions like if I go Medicare Advantage first, and then I want to go back to Medigap in the future. If I miss that 6-month window, I'm now going to have to go through medical underwriting. So I get the question a lot, can I switch between the two? The answer is maybe. If you go through medical underwriting and you get denied, you may not be able to go Medicare Advantage to Medigap, but you can almost always go Medigap to Medicare Advantage. So sometimes, I'll hear folks say, well, I'm going to start on Medigap, see how much I'm using that coverage, see if I need that flexibility. And then if I realize I really did one place, I like the bundled lower cost of a Medicare Advantage plan, you can always switch in the future. Now, when we think about total cost, we want to think about a couple of things. We have our $0 for Part A, we have our $2,100 for Part B, we have our $420 for our Part D, and then you're going to see a range for Medigap G. Now we're pricing out the high end of the range here, or of costs overall, but you'll see this range goes from $1,200 to $6,000, which is a really big range. Well, why the range? Medigap is zip code specific. So someone in Texas might pay $100 to $300 per month for Medigap G, where that exact same person in New York State might pay $300 to $500 per month for Medigap G. On average, annual costs for healthcare and retirement at the top end, because we're using a Medigap plan, it's realistic to see $4,800 to $9,200 per year per person. So if you're a married couple, double that. These are big expenses. We want to make sure we're working this into the financial planning that you're doing, so that when you hit day one of retirement, you feel really confident in not only what are my costs, but how are we going to cover those costs. Let's jump down a slide. The next thing I want to touch on is how income affects Medicare costs. I'm going to jump down one more slide here. I want to introduce you to IRMA, or Medicare's Income-Related Monthly Adjustment Amount. This is a premium surcharge for individuals or couples making more than a certain amount each year. So if you're an individual and you make more than $103,000 per year, or you're married filing jointly making more than $206,000 per year, you'll see that that baseline of premiums on Part B and Part D start to increase. Now, IRMA can add anywhere between $1,000 to $6,000 per year to your healthcare costs on top of what we just looked at back there, that $4,800 to $9,200. So it's significant. Well, how does IRMA work? IRMA is basically an annual surcharge that's assessed each year on a 2-year look back. So 2024 IRMA surcharges are based on 2022 income. 2025 IRMA surcharges will be based on 2023 income. So it resets each year, but it's always a 2-year look back. This is why it's really, really important to have that partnership with your financial advisor to ensure that when you're doing taxable transactions or you're monitoring your income, we're being really mindful of not only how that impacts you in your current tax year, but how this may have a ripple effect down the line on your Medicare premiums in the future. Now, what IRMA looks at is it looks at your modified adjusted gross income plus any tax-exempt interest income. So municipal bond income is not safe here. Things that go into IRMA: employment income, the taxable portion of your Social Security, retirement account distributions, required minimum distributions, dividends and capital gains, pension income, all things that would flow through to IRMA. Again, IRMA is assessed each year. So if you have a particularly high income year, it's not like you're stuck with that surcharge. It would be assessed again in the next year, but always on that 2-year look back. So IRMA is just a really important consideration when we start to think through, what does my overall income picture look like? How am I monitoring my income over time? And how am I working with my advisor to be really careful if I need to take that distribution for, my dream beach house or, that cabin on the lake? Am I being really mindful of thinking not only how does this impact me this year, but how does this impact me 2 years from now on those decisions as well? Let's go ahead and jump down a slide. The last thing I want to touch on this evening is going to be long-term care. Now, you heard me mention at the top of our conversation, but long-term care outside of 100 days in a skilled nursing facility is not included in Medicare. So it's a cost that we need to think about and plan for separately. Let's go ahead and jump down 2 slides for me. Actually, 3 slides. Perfect. So when we think about long-term care, and you heard me mention this before, 51% of people won't need any long-term care costs at all. So this is where it's tricky. We're planning on something that may or may not happen. But what we know is for those who do have long-term care costs, they can be incredibly significant. We look at this and we say 15% of people can expect to pay more than $250,000 in long-term care costs. And I always like to think that 15% really doesn't tell the full story either. If we broke that 15% down and we looked at the 5% at the very top end, you're going to see much more significant costs. So what I'd encourage you to think about, you heard me mention this before, is not only will your portfolio during your lifetime and your needs withstand a long-term care event, but how might this impact the legacy you want to leave? Will you still be able to help kids buy their first home or grandkids, pay for college? How is this going to change the plans that you have in place? A couple different options here when we think about long-term care. You might decide to set aside special savings for long-term care. Maybe we make a long-term care goal as part of your portfolio and allocate a specific portion to that long-term care savings. You might decide, hey, I'll use my retirement savings to fund my long-term care needs if and when they occur. You may end up purchasing a long-term care insurance policy or a life insurance policy with a long-term care rider. Again, no right or wrong answers here. They're all different options. We want to make sure you land on one that you feel really comfortable with. We also want to make sure that we're really considering this in the greater context of your goals and how they may be impacted. Long-term care costs are also incredibly variable depending on the level of care that you need. If you're looking at something like an adult daycare, you might be looking at $10,000 a year. If you're looking at something like a private room in a nursing home, well over $100,000, and you start to think of a memory care situation, significantly higher than that. That's where it's really important to think through, what is the range of options? What's my family history of long-term care needs? And what does care look like for me? Where do I want to receive it? How do I want to receive it? Who do I want it to be provided to? Who do I want it to be provided to me by? All those factors are going to be really important when we start to make those decisions on those next steps. Let's go ahead and jump down a slide. So last couple items I want to touch on before I open it up to questions here this evening. A couple different things I'd encourage you to do. I want you to review your income, insurance, and healthcare needs, goals, and changes with your advisor annually. We want to check in and see, have we seen changes in your retirement date? Are you going to work longer than you originally anticipated? Are you going to retire earlier than you originally anticipated? What are our healthcare plans? Are we on top of this on either side of the coin? We want to make sure that you take full advantage of shopping different parts of the Medicare system during open enrollment each year if you need to. So Part D is a great example here. A lot of folks will get into their Part D plan right off the bat, because you're supposed to, and then never really look at it again. Well, your needs will change over time for prescription drugs. So we want to make sure that we're staying on top of that and shopping the Part D plan that we have in place to make sure that you have the right level of coverage and the right level of cost long-term. We want to make sure that we're reviewing your healthcare directives. Again, this ties back to our long-term care conversation. Are we making sure that we're staying on top of who's going to provide that care? Who would be in charge financially, health-wise, if you are unable to make decisions for yourself? And finally, we want to make sure that if you're not at Medicare age yet, have we thought through the best way to save? Have we built this into the financial planning that we've done? Have we talked about how this will impact your goals and your spending during your retired years? If we start to be really mindful and considerate of these healthcare costs early and often, it's going to set you up for success to make sure that they're not only covered, but that you feel really confident as you move into those years. So I know this is a ton of information. I know it's fairly quick. I'd love it to open it up to questions. Happy to go deeper on any area. Really happy to answer anything here.
Okay, so if anyone has any questions, feel free to unmute yourself and turn on your video.
Yeah, I have one question. One second.
Hi, Bernard.
Hi there. There's a bad echo here. So can you turn off yours, Yvonne, or something? Can you hear me?
Yes, we can.
Great.
Hello. You can hear me?
We
We
can.
can hear you. Yep.
Okay, I'm sorry. Yeah, the question I guess I had is, would it be your assertion then that, okay, the 50% people who don't need that long-term care should, because they can't tell the future no more than anybody else.
Right.
Would it be your assertion then that all those people should be planning for having care, and then not only that, but planning for the worst case scenario, like the 15% or whatever that final block number was, is in order to be absolutely safe? Is that what we should be all doing?
That's a tricky question because we're planning around against something we don't know if it'll happen.
Yeah.
So I'm going to give you two parts of an answer. First, I think everyone should have a conversation about planning for long-term care. Because we don't know if we'll end up in that 51% or the 49% who will need care, I think it's important for everyone to think through, what if it does happen to me? The next question is, on what level do I plan for? What I like to do in this scenario is test out a couple different levels. So maybe you sit down and you stress test the financial plan on the lower end of the spectrum, maybe on the medium end of the spectrum, and maybe on the high end. And we see, how does that change the outcome of your financial plan? This is exactly why you have a partnership with a financial advisor, is to be able to do that kind of process. And then what I usually find is we can land on somewhere that feels most comfortable. It's still a guess. There's no perfect answer to this one, but I find that it's just a good way to kind of see a range of outcomes there.
So it's like investing. It's how much risk do you want to take?
Exactly.
Yeah. Okay.
It's a great question, though. Thank you for that.
You're welcome.
Yeah, that was a fantastic question, Bernard. Thank you. Who else? Don't be shy. Go ahead and unmute yourself and turn on your video. So while we're waiting for,
Hello. Good
Hi, Juan.
afternoon, everyone. So I had a quick question. So last week I actually attended a seminar for the Financial Planning Association, and it was kind of on this subject too. And
Okay.
a big question I did have towards the end was how inflation's going to play a factor during the long run, especially for the younger generation, and how do we kind of prepare for those price increases?
Yeah, it's another fantastic question. Inflation is definitely going to play a role. You know, when we start to think about increasing costs, healthcare is a big area. And we usually say that healthcare, you could probably expect to see arguably an even higher rate of inflation than maybe like CPI, like traditional inflation that we see. So maybe we take a more conservative approach when we do that planning. We start to think through, what is an appropriate inflation amount, or what do we feel comfortable with? from an assumption standpoint, because costs will likely be higher down the line as we could see continued increasing costs of care, right? It costs doctors more to have space to provide care. It costs more to employ people to provide care. So we're going to continue to see those costs tick up. That's where I think planning early and often is really important, because we start to be able to work those costs in over time and adjust them in real time. So we're not planning on something once at, maybe when you're 40, and then we're not touching it again until you're 60. We want to make sure we're checking in on that over time. So we're tracking those price increases. Now, there's going to be other ways that Medicare is impacted. We'll likely see increased IRMA thresholds. We usually see those each year. There will likely be a couple of different areas. But what I would say is just early and often planning, making sure that we're staying on top of those financial plans and working in a really appropriate inflation level.
Okay, thank you.
Absolutely.
Well, and thank you so much for joining us. We really so appreciate our Chico State students. We have a strong partnership with the financial planning department there. And Chico State was just recently accredited to teach the financial planning coursework.
Oh, that's wonderful.
Yeah, it's fantastic. And so what else? Feel free to just open up your mic and your video. I do have another question, though. So, Alison, could you talk some more about the IRMA and the life-changing events, and how does that work?
Yeah, I'm glad you brought that up. So IRMA is a surcharge. Like I said, it's assessed each year, and it's on a 2-year look back. Let's take an example of someone, though. Let's say we have someone who's retiring when they're 66. So their original Medicare premiums are going to be based on their age 64 income. And let's say the year that they're retiring, when they're turning 66, let's say they turn 66 in February. So they're only going to have really 2 months of income at their full working level. So when we think about that, their Medicare premiums are based on their age 64 income, which is a whole lot higher than at age 66. Well, Medicare would consider that a life-changing event. You've retired. We call that a work reduction or retirement. In that scenario where you've had a life-changing event, think retirement, death, divorce, loss of an income-producing property, loss of a pension, you can actually appeal your IRMA surcharge. And not only will Medicare reduce the premium that you're paying, they'll actually pay you back for anything that you've overpaid as well. So if you're in that scenario where your income when you're getting your Medicare premium is really not reflective of your income long-term, go through that process. It can take a little bit of time for them to process the form. It's a really straightforward form, though. It's form SSA-44. And, it's a great option. Get those dollars back. Like I said, IRMA can add anywhere between $1,000 to $6,000 per year. So if you've had that scenario, it's worthwhile going through that process.
Mm-hmm. In our community, where that life-changing event adjustment comes into play is due to campfire payouts, where due to the settlement, it will give them a big pop of income, affect their, make them subject to the IRMA surcharge. And so it's a way to be able to drop that off so that Social Security recognizes it's a one-time event.
That's great. Yeah, definitely important to be aware of and take advantage of.
I've got a question.
Yeah.
Turn yours down. So there was a lot of talk about people who are earning and working through the years and retiring. What about those of us who were homemakers and basically worked our butts off but worked for free?
Great question. I love that one too, because the work that we're doing in the home is just as important as the work that we're doing in the office. Absolutely critical. So the way that Medicare works is as long as you or your spouse worked and paid into the system for at least 10 years, you'll qualify for benefits. So it takes that into account that both parties in a married couple may not be working traditionally full time. On the Social Security side, it's going to be a little bit different because that's going to be based on your years of earning, but you can always make a spousal claim on Social Security as long as you qualify. So there are definitely ways that this system recognizes that not everyone will have the traditional income coming in. Medicare, you'll be just totally fine though. Medicare is really easy to navigate on that one.
Okay, thank you.
Absolutely, great question.
Alison, I have one more.
Please.
You'll hate me for this.
No.
Who should I vote for next week in order to have the easiest job going forward with this stuff?
Oh, I can't answer that one. I wish I had the magic ball that would tell me who would, reform the healthcare system entirely. It's tricky, right? Both parties are going to have different takes on the policies. It's really a challenging one to answer, but I think we'll see. Yeah, no, we can't answer that one, unfortunately, because we don't know. We don't know, unfortunately.
I'm sure.
Oh, we got another question that came through on chat from Michaela. So thank you for organizing this. You're welcome. It's our pleasure. Do you ever see folks insured under Medicare who still experience out-of-pocket costs for care? If there are unpaid costs incurred under Medicare, do these costs default to next of kin?
Great question. So yes, let's take our example. If you had just original Medicare, so parts A and B, and you didn't have a Medigap policy, you'd likely then be paying that 20% out of pocket. Even if you have a Medigap policy, you still may be paying a little bit out of pocket, just depending on the Medigap policy that you select. And then if we have unpaid costs that aren't paid, it'll be treated like any other medical debt. So it would basically then go to anyone who survives you if you pass away, or you would be responsible for it during your lifetime. It's basically going to be treated very similar to if you went to the doctor. Now, if you're employed, you go to the doctor, you get billed a copay and you don't pay it, it's going to feel very similar to that. You'll still be responsible for it long term.
Oh, interesting. Great question, Michaela. We have the smartest audience.
We do. Oh my
we
gosh.
do. These are great questions. Oh, so okay. So another one. Someone just texted me this. Can you, Alison? Could you talk some more about the Medigap and that 6-month window?
Yeah, this is so important. I could probably talk for a whole hour on this alone. So basically, remember, when you sign up for original Medicare, which is A and B, and you'll do that through, when you're ready, you'll do that through the Social Security Administration, actually. You sign up for it on SSA.gov, just like you sign up for your Social Security benefits. Once you sign up for Part B, you basically unlock a 6-month window to get into a Medigap policy with no medical underwriting. If you miss that 6-month window, whether it's because you just didn't do it, or you didn't know about it, or you signed up for Medicare Advantage instead of going Medigap, you'll have to go through underwriting. Medical underwriting is extensive and invasive if you haven't been through it. I like to joke, they like to basically know every time you even drove past a doctor's office. It's a lot. It can feel really overwhelming, and they can deny you coverage. So what I always tell clients and advisors when we have conversations like this, when you think healthcare decisions, I want you to be able to answer 3 big things. What am I getting? What am I giving up? And what is it costing me? And if I know you can answer those 3 questions, I know you have a fundamental understanding of your coverage. I know you have a fundamental understanding of the different options that exist outside of your coverage. And I know you really understand what you're paying. So that's what I would focus on. But again, just be really careful with that 6-month window. I would say probably the biggest thing that's missed in Medicare planning.
Wow. That is a little known fact. So that's only available, that 6-month window with no underwriting under the Medigap option 2.
Yes, exactly.
Not
That's only if you're going to go
option 1 or 3.
Right. It's only if you're going to want a Medigap policy. But like I said, sometimes what happens is Medicare Advantage is really heavily advertised. So folks will go Medicare Advantage first, not even knowing about this 6-month window. Then they'll realize they need more flexibility in the providers that they see. They want to go to Medigap, and suddenly they can't because they have to go through full underwriting and they get denied. So that's the risk there.
Interesting, interesting. And so, as everyone can sense, the Medicare and healthcare coverage, especially in retirement, is so complicated. So of course we want you to be working with specialists in this field. So luckily there are some low cost and no cost resources. So for example, in every state, there is what's called a HICAP program, HICAP, which stands for Health Insurance Counseling and Advocacy Program. So it is a state-sponsored, volunteer-supported program that provides like free counseling to people with Medicare about their options, their rights, and health insurance-related questions. So what they do is they partner with different local agencies. So in our community, they have partnered with Passages and Chico State. So it's a no-cost way to be able to get time with someone that can go through all of these details. The option 1, 2, 3, talk about the Medigap, talk about the IRMA, and so forth. Also, as well, is that if you would like more personalized support, which I recommend. So if you're working with our office, then I have a precious little Rolodex of trusted insurance advisors in our community that I can get you connected with so that they can sit down with you, have these conversations, those 3 questions that Alison brought up, and talk specifically about what your current medical diagnoses are, the prescriptions you're on, what it looks like for future years for you, what your out-of-pocket is. And so especially now during the Medicare open enrollment period is really when we want to make sure we're having these conversations. Okay. And then let's see, what else? More questions. Keep them coming.
Like I said, if you get off this call today and you think of a pressing question, we're here to help. So you can always, shoot them over to Kim and she can get them over to me as well. So I know that's sometimes how it goes, is you're on here and you can't think of any, and then you jump off and you think of that one pressing one. So we're here to help in the future too.
Perfect. Well, Alison, your presentation was perfect. It was so timely and informative. We learned so much today. And so we're actually perfect timing. We're right at time at 6:27. And so when you sign off on the Zoom meeting, what you're going to be presented with is a short survey. If you can please just take a few minutes to answer those surveys. And what it does is it gives us feedback on today's event, as well as ideas for future events, because we do read every single one of the responses, and we take it to heart, and we're always looking to improve. So thank you again, everyone, for joining us today. I say this all the time, but I care deeply for each one of you, and I'm grateful for you in my life. So thank you so much for participating today, and we'll see you again soon. Bye-bye, everyone.
Thanks so much.